For the millions of patients who have lost kidney function through disease or injury, dialysis is a life-saving procedure. It replaces the vital function of the kidneys by filtering waste products from the blood that would otherwise reach fatal concentrations within weeks. However, hemodialysis has some severe side effects, including cognitive impairment and brain injury. Patients often develop a difficulty in planning and making decisions, and this is called executive function. So for my thesis, we're performing MRI scans during dialysis for the first time so we can understand what dialysis is doing to the brain. This image is a color map before and during dialysis, where red means more and blue means less. You can see there's a drastic reduction in blood flow during dialysis compared to before. Now you might be wondering, how can dialysis affect the brain at all? The answer is through the cardiovascular system. By removing 15% of the blood volume and rapidly changing its composition, the cardiovascular system is impaired and it can no longer support the brain that requires 20% of your energy, even at rest. Over here we have another MRI image, but a different type of MRI. And using this, I've discovered that during dialysis, the patients experience a type of edema, which is also seen in stroke patients in the acute phase. So we believe that the pathogenesis of dialysis may be similar to that of stroke. This is particularly worrying if you consider that end-stage renal disease patients undergo dialysis 3 times a week. So you can compare that to experiencing a mini stroke 3 times per week. And you can imagine how catastrophic that would be for the brain. It's no wonder that we observe cognitive impairment in this cohort. We're also testing a novel intervention that involves briefly restricting blood flow to a region where the body can handle it, skeletal muscle. This seems to teach the body how to cope with ischemic events, and it's been shown to protect other organs. I want to end by reminding you that dialysis is a life-saving procedure, but simply keeping patients alive is not enough. We need to continue refining these interventions so that patients can live more healthy, active, and fulfilling lives. Thank you.